Hello and welcome. This is Intimacy After, a podcast for mature women facing intimacy issues from various causes. Please know you are not alone. It is time to stop suffering in silence. On this podcast, we give hope that through practice of simple steps and proven tips, you can improve intimacy and resurrect your love life. Break free, learn to laugh again, to play again, to be happy, to love, and know that you are loved. I am your host, Queen. Come on inside. Hey, sister friend, welcome inside to the first episode of Intimacy After. So finally, right? I finally did it. This has only been waiting for, a few years, but I got through the paralysis analysis to have perfection, and here we are today on the very first podcast. So we're talking about intimacy after body changes, and you have asked me questions time and again over many years, and I've always desired to answer you fully, to sit down and just have a chat, right? I've answered your questions in the hallways of the hospitals. I've answered you after church services. I've even answered you, in the grocery store. Yes. We've been having conversations all over. And so I invite you to listen through to the very end because this will also be for you. As a cancer doctor, the information I provide will have some cancer information, but there will be nuggets in this for you also. Trust me. You may not be a cancer survivor, but you know or will know someone diagnosed with cancer, starting the process, in the middle of the process, or a cancer survivor. So, if nothing else, you will know how to support your sister friends who are going through the cancer survivor process. And so now, though, I want to take the time to address your intimacy issues after body changes, but specifically today for the body changes you've been experiencing after cancer treatment. Body change is a topic that deeply affects us women, whether it's weight changes, scars, the way you may look or feel about the way you think that you look. So why shroud it off in silence or accept it as is? It is what it is. But while partially true, it doesn't have to be that way. I first started paying attention to this issue when I was stationed back at Brooke Army Medical Center. That was like 2008 to 2010. I was in Texas. I was the only female radiation oncologist amidst 4 total. There were 3 other male doctors, and they were phenomenal, like absolutely phenomenal. They helped train me as a junior staff radiation oncologist, so they were great. However, there were female patients that would approach me time and again in the hospital always and just ask me questions. Not right off the bat. You know how y'all do, right? You would say, "Hey, how you doing, doc? I heard you were from Jamaica. I had a friend from Jamaica named Zena," whatever the name may be. "Do you know him or her?" "Oh yeah, welcome." And then you hit me with, yeah, can I ask you a quick question though?" "Okay, yeah, sure." Then it's like the floodgates just open up, "Oh, I'm seeing a doctor on your team, but I didn't know how to ask him about, like, when is it safe to start having sex? And will it hurt? Will the radiation affect my husband? What about the cancer I had? Will it cause any problems for him? Because he's kind of scared and we haven't been doing anything for a while. And the scars, will they go away? And if I rub them with something, will it make it better? I don't even want to touch or see the scars. Most times I was like, whoa, wait a minute. Let's go over to the side for some privacy or open an office, right? I specifically recall a trip to South Africa while I was on vacation. I was on vacation on safari when I was being asked questions about some cancer issues within a family and side effects. I know those questions exist and the answers are hard to find. I get these questions all the time. So I want to start off by saying, look, you're not alone. You are not alone. Because I know the minute I say cancer to someone, I get all the floodgates of questions. But guess what? I'm retired out of the Army now. I'm on extended sabbatical, and I have given myself permission to have the opportunity to finally communicate with you and answer some of the more common questions that you have been asking me. And that's regarding intimacy issues caused by various reasons. So I'm going to start off with the most common question I always get: body changes associated with post-cancer treatment. So we're going to talk about surgical scars and also physical changes and challenges after cancer treatment. These are random examples and not at all inclusive. So we can start with head and neck cancers, right? You can have scarring from surgery in the neck, the mouth, tongue, etc., and or radiation. Even if you didn't have surgery, radiation can cause fibrosis in the head and neck area. That is, make it feel thick and not as pliable or soft as other skin. It is difficult to have a certain level of intimacy without touching the neck or kissing, so this can be devastating for some couples who prefer certain encounter. In some sessions, I do offer steps to possibly overcome some of these expectations. Now, when we talk about lung cancer, if caught early on screening CT scan, it can now easily be treated with a special type of radiation therapy over 3 to 5 treatments, no surgery. No, ma'am, don't misquote me. I did not say that you cannot do surgery and you should do only radiation. Nope. This only applies if it is caught early. If not, then it's surgery plus or minus chemo plus or minus radiation therapy. So the scar here only applies if you're deemed fit enough to have surgery. I know not all of you diagnosed with lung cancers are smokers. Most of you are, but not all. If your team states only radiation, then there won't be any scar. But there will be other things to think about. Intimacy is affected mostly here by breathing issues, right? Yes, things can still be done safely, but sweetheart, if you're on supplemental oxygen, you will most definitely need to speak with your pulmonologist, and depending on the intensity of your intended encounter, your cardiologist too. Well, this goes for everyone. When it comes to your heart, really, females can have very intense orgasms too. Haven't had one in a while or ever? Keep listening to future podcasts. We will address that too. For breast cancer, the outcome depends on the type of surgery you had and the size of your breast. Lumpectomy can be great for many, but depending on the size of the tumor ratio to the size of your breast, there may be a defect or a divot that's left behind, and fluid can accumulate here called seroma and remain for a long time, up to years. And this can become firm in the area and kind of rock hard. And radiation, that may shrink the breast a little more, and that area of seroma can become firmer in the surgical area too over time. Some patients may still have their nipple after lumpectomy, some may not. If the nipple area is part of your foreplay, then this will definitely have a negative impact on your intimacy. That's why it's so important to talk to your surgeon about the type of surgery you'll be having and the long-term outcome. Foreplay may be foreign word to you, as some folks do not participate and see that as a waste of time. No judgment here. No, none at all. But if you had mastectomy and you pride yourself on your breast as well as your husband did, then this can and has caused the dreaded D word, divorce, to come forth. I cannot begin to tell you the marital issues I have witnessed cancer causing over the years. Sometimes it could have been resolved with recognition and willingness to adapt. Life is all about adaptation, not easy, dear. Not by any stretch of the imagination, but it can be done. When I was stationed out at Walter Reed Bethesda, Maryland, I mentored a group of kids during the summer who were interested in medicine. We were able to visit the centers where soldiers were being rehabilitated for limb loss, extremity trauma, etc. It was called the Center for the Intrepid or something like that, but I think the name may have changed since then. It was Amazing to see how soldiers adjusted to the trauma. A lot of psychological work was done, though, that grit and toughness got them through it. So it is with cancer. It's a battle, and many of you have battle scars that goes deep. I am not here to solve them all, but I do know if and when recognized, it's the first step in the right direction. So think about it. Abdominal and pelvic cancers are many, and I have to group them together here because there's so many of them. But you talk about colon cancer, rectal cancer, anal cancer, cervical cancer, uterine cancer, cancer of the vagina and or vulva and other areas, anything below your umbilicus or the belly button. Those area can cause a slew of issue in the post-cancer treatment setting, from surgical scars to hair loss, alopecia in the area treated, right? Vaginal dryness from radiation, and the feared ostomy bag. For those of you who are unaware of what an ostomy is, put simply, that is when one is not able to have bowel movement the usual way through the anus, but stool comes out to the left or right of the umbilicus, shortly around where the belt is located, and it comes out in a bag. The issues faced with leakage, gas, flatulence from the bag, needing to empty in public, and the anxiety that causes, getting clothing that fits to hide or cover the ostomy. But in intimate situation, that cannot be hidden. Our conversations about getting a good seal, staying away from gassy food, fashionable covers for the ostomy, oil fragrance for the area, and different positioning was only successful because of the communication and willingness to do some work to adapt. Not only you yourself, but also the willingness of your spouse. So, sister friend, if you have an ostomy and have been living ashamed, there is a way to still be fulfilled through intimacy, if you so desire. Again, I am touching the surface here on some of the conversations had, the many life experiences shared, only to make others better. Depending on your feedback and requests, I can certainly return to some of these topics too in future podcasts. Well, what about hair loss? I know some of you initially go to thinking about the hair on your head, but in some cultures, the hairy legs and hairy pubic area is, well, desirable. And don't you dare say ew. When I was growing up in Jamaica, we certainly did not shave our legs or armpits. Don't you wish sometimes you don't have to shave like all the time? I'm just saying. So no hair in certain areas can greatly affect sexuality. It may enhance it or it may be problematic. You may find that your hubby like the alopecia / bald look of the pubic area. In that case, this could be a tremendous booster for you. Who knew? I promise you, they did not teach us about these things in medical school or in my radiation oncology residency. So I thank you, my patients, over the years since 2004, all my patients, so very much for educating me. So now I can share with you so you know you are not alone. I will be addressing weight changes for women in general in the next podcast. But of all the patients I have seen over the years, I had a number of encounters which were counterintuitive in that spouses can become very concerned that their wife has lost a lot of weight. For example, someone who's 5'5" who typically weigh close to 200 pounds. If you lose a lot of weight during cancer treatment and drop down to 130 pounds, then in that case, your spouse may be afraid that he would hurt you, even though the desire was still there for both of them. Yep, weight loss can be a big issue post-cancer treatment. Treatments can also cause vaginal dryness and general pain during sexual activity. There are different types of pain and different levels of pain. There are pain causes by soreness, of the sexual organs, pain from arthritis that limits your position and the functions that you can do, and thereby affecting your desire as well. No one wants to do anything when they are in these type of pain. Then there is the ever elusive nerve type pain that is shooting, or it can be dull and throbbing in nature and seemingly always present. Pain and discomfort from these types of physical changes after cancer treatment can be challenging, but there are some solutions. Solutions like lubricants, dilators, and medication can help alleviate some of these issues. And time and again, I have used these in my clinical practices. What I've been told is that not all lubricants are created equal. So you may have to try a few to get to the correct one for you. Different type of dryness exist. So one may be oily, one may be water-based. You have to find what works for you. We will have a gynecologist during the latter part of our podcast on menopause who will discuss the available treatments, be it prescribed, but also natural treatments available for vaginal dryness that's caused from the decrease in our estrogen levels. If you had any type of radiation treatment below the umbilicus, that's the belly button, scattered dose can cause narrowing and dryness of the vaginal vault. The radiation oncologist should have given you a vaginal dilator if indicated. These come in various sizes and can help keep the vagina stretched for the purpose of future exam. If not done, the area can become scarred and too narrow for a speculum exam. As much as we don't like doing a speculum exam, it is something that's necessary. In most cases, sexual intercourse is prescribed or recommended. I know. This can be considered purely clinical. The vaginal vault need to remain accessible for exams to rule out local cancer recurrence. Prescribing intercourse does work too. I did create instructions on how to use a vaginal dilator, how long to use it, when to increase the size. No, this is not a dildo. It's for clinical purpose only. And a patient of mine received a vaginal dilator from her gynecologist and said, "Doc, I don't know how to use this. I couldn't find instructions anywhere, so I created one." Fatigue and energy levels. Cancer and its treatments can often lead to prolonged fatigue, making sexual activity seem less appealing or feasible. There are many things that can be done to try and increase your energy level, but if you're not eating right, getting some exercise in, and remember, exercise is not lifting heavy weights all the time. Even something as simple as walking around the block on a regular basis will do. So you have to be aware of your fatigue and energy level in order to engage in sexual activity. In regards to emotional and psychological effects, the emotional toll of a cancer diagnosis and treatment can lead to anxiety and depression, affecting desire and sexual satisfaction. This is not your regular anxiety and depression, right? It has something else tied to it. So you have to be honest and open with your counselor about the cause of your depression and anxiety. The fear that cancer might come back can be a constant concern, impacting intimacy and the ability to fully engage in sexual activities. Again, you also have to be transparent. Rebuilding self-esteem and confidence post-treatment is crucial. I encourage you to show self-compassion and do positive self-talk. This can help tremendously in your process of improving in this area. It's important that you know that there is ongoing research at institutions like the National Cancer Institute that focuses on developing supportive programs that include both psychological counseling and practical strategies to help cancer survivors like you cope with changes in intimacy and body images. Now, there's a component of spiritual and relational dynamics in everything, and that includes cancer. And for many, cancer forces a reevaluation of what intimacy means. Emphasizing emotional and spiritual connection over physical acts can strengthen your relationship with your spouse. Open and honest communication about needs, fears, and desire is essential. encouraging yourself, encouraging your spouse to discuss your feeling and explore new ways of being intimate is very helpful. Your partner needs to be supportive and patient too, and understand that recovery and adjustment takes time. There is no set time. Everybody is different. Now, for the single ladies, I have not forgotten about you. Intimacy for single survivors, this may have to be a closed webinar, ladies, because I have to get into the weeds. It is not the same for those who are married for so many reasons, and the focus is quite different. Single survivors would need to look at self-exploration, hint, hint, and understanding their new sexual selves, which can be very challenging if you are single, never married, and if you're a virgin or never really explore anything in this area. There is so much to discuss. Navigating the dating scene can be daunting. Discussing when and how to disclose your cancer history to potential partner is important. Now, that depends on if you're on the fast track, or if you're one of those who wait for a long time before anything happens. So this has to be individualized. As a single survivor, you need to build confidence through support groups, therapy, and personal growth activities that can empower you to seek fulfilling relationships. Haven't forgotten about you, but stay tuned, my single survivors. I have more coming for you, dear. So today, we simply identify some of the issues with body images that you as a cancer survivor may have. The first step is identifying there is an issue or change with my body that is affecting my sex life. You have to say it. There is an issue or change with my body that is affecting my sex life. Next, you must communicate with your spouse and your doctor about what changes you are noticing and the issues that you're having with intimacy, or what's blocking you from taking that next step. Physical, emotional, psychological. Too shy to communicate with your doc in person? Not comfortable talking with that young-looking doc who could be your daughter or son or grandchild? Well, technology is a wonderful thing. You can now send questions via the patient portal. They will respond there or discuss with you at your next follow-up. In some cases, you may have to embrace body changes, surgical scar, nerve damages in your hands or feet from diabetes or cancer treatment, alopecia, be it from cancer treatment or hereditary or stress. Communication with your partners and seeking support is paramount. Next, I want to dig a little deeper and do part 2 of this body image podcast on weight gain. We will specifically dive a bit more into how body changes affects intimacy. I intend to meet and chat with you every first and third magnificent Monday of the month. Twice per month, ladies. I got to get the stuff right for you. On the 4th Monday, would love to try and go old school with a call-in Q&A or live conversation with a guest. This podcast is for you and all about you, so let me know what you think. Well, sister friend, I know you have choices, so I thank you for tuning into Intimacy After podcast. You may subscribe for bi-monthly alerts or stay in the know by visiting my website at queenquanta.com. That's Queen, Quanta.com. Until next time, remember, a life without intimacy is like your favorite meal without salt. Ladies, let's spice it up. Life is beautiful and God is awesome. This is Queen, signing out.